Hi, I'm Izzy Klava, and today I will be doing nutritional counseling with my patient Becky. How are you today?
I'm good, thank you.
First of all, I want to thank you for filling this out and helping me with this process. Today, we're going to be discussing the importance of nutrition and oral health and why you're doing this process. The reason that nutrition counseling, the reason that we do this is to help prevent dental diseases such as cavities and gingivitis. Gingivitis is an inflammation of the gums, which is reversible with treatment about 2 weeks. It'll go away. If the inflammation continues or gets worse, it will lead to periodontal disease, which is irreversible damage to the soft tissues surrounding the teeth, which can lead to things as bone loss or tooth loss. The reason that nutrition is a vital point in preventing things such as caries, or which are cavities, is because the excess amount of sucrose or sugar in the foods that we eat can cause saliva to become acidic, which can weaken the teeth and soft tissues around the teeth, which can lead to those diseases we had mentioned. So let's briefly discuss your medical and dental history. I see that you visit the dentist twice annually,
Yes.
which is great for cleaning and checkups. You drink the city's tap water along with bottled water, but the city's tap water is a great preventative measure as it is fluorinated, so that fluorine will help strengthen and prevent tooth decay. You have dental sealants when you were younger, which I would recommend updating if you haven't, because those sealants help to prevent cariogenic or cavity-causing materials into the pits and grooves of your teeth. You have implants on teeth 18 and 31, which is the mandibular molars of your teeth, so the lower jaw. You wear a splint at night, which helps protect against grinding, and you want to make sure that you keep brushing that splint regularly after you wake up in the morning, which you do, which helps remove that bacteria that grew on overnight, which can also increase the pH in your mouth. Do you brush and floss regularly?
Yes.
Do you use a fluoride toothpaste? Do you know?
Yes.
This is, again, great, as you know, fluoride will increase the strength of your teeth. We're going to briefly discuss your medical history. The only major problem that I noticed potentially affecting your oral health is the fact that you are sensitive to lactose, which can decrease the calcium intake in your body, but you do take supplements to help.
Correct.
As well, and you drink almond milk, so you do get some protein in there as well. You are moderately active, which is great, so 30 to 60 minutes a day, and you drink a lot of water, which is good as it helps to flush out the teeth.
Mm-hmm.
Now that we have discussed your histories, let's discuss your risk for caries and your food log, So based on the foods that you've eaten, what we've talked about, out of the 3 categories, liquid, solid, and sticky, are slowly dissolving. I find that the most food that you eat falls into the solid or sticky category, which includes things like bananas, cookies, muffins, jelly, stuff like that, raisins. You also have some food that falls into that liquid category, which would be your non-dairy creamer with your coconut creamer. The explanation of the solid and sticky foods is that they do promote decay, but they're moderately dissolving. So again, you want to make sure you focus on cleansing your mouth after, so whether that be brushing or drinking water. The non-dairy creamer is liquid, so it does promote decay, but the positive of that is it does flush out of your mouth faster, but again, making sure that you're eating that in moderation or brushing and flossing between that.
Okay.
So let's go over your foods. For breakfast, I see that you have a cup of Cheerios, a cup of unsweetened almond milk, a container of Good Belly lacto-free strawberry yogurt. So, do you have any idea what would be the greatest risk of caries in that out of those foods that you ate?
Probably the Cheerios.
Yes. Also, I had because the starchiness. Yes.
Yep.
I also had the coffee creamer as well, because again, that would be that sugary sweet that would increase the possibility of decay. So I recommend for that with the Cheerios, again, drinking water regularly throughout the day, or with that coffee creamer. I know it's probably hard, but even to stagger your coffee consumption to every other day or not as much in between. And you don't typically only have 1 cup a day, so it shouldn't be a huge issue. For lunch, I see that you had a taco salad with shredded lettuce, tomato, and Frito chips with 2 tablespoons of French dressing, and also your cup of mixed blueberries and red grapes. In this meal, I believe the Frito chips would probably be the most cavity-causing or carie-causing item because they are sticky and they get stuck in your teeth. Also, you have to watch your dressing intake because you had full-fat dressing with this, but items that have reduced fat or low fat can often have added sugar.
Okay.
So those would be things to avoid. It's also good that you do have fruits and veggies in there as well. Try and even eat harder, crunchier fruits and vegetables like apples or carrots or celery, things like that, because that'll be that natural mechanical mechanism to clean that biofilm or plaque off of your teeth.
Okay.
The next thing, we talked about your coffee there. So for dinner, you had chicken breasts with French fries and a small dinner salad with a tablespoon of French dressing. I believe that the potatoes or the French fries in this case would be the most cariogenic because they're very starchy, which can not only stick and be sticky in your mouth, but can cause the mouth to dry out, which would decrease the saliva production. That decrease of saliva production can then decrease fluorination, which, as we discussed, can weaken the teeth potentially and cause cavities. The most least unhealthful food choice made was probably that cookie, just because it is super starchy and the raisins definitely get stuck to your teeth. You did have it at 7 p.m., so again, if you were planning on going to bed right after, just brushing really good or drinking water to flush that out. Other than that, we talked about your goals, ways to improve. Well, I guess your goal was to avoid those refined starchy grains, which is great because, as we talked about, those can, increase those intakes of cavities because of the starches. 2 ways I think you can achieve this goal are avoiding things such as muffins, cookies, and cakes. These are obviously okay in moderation as long as you drink water or flush your mouth and brush afterwards. Another thing is we talked about a little bit is try eating more of those crunchy foods, especially fruits and veggies, as they help to naturally clean your teeth from that biofilm and that sucrose. And examples would be apples and carrots. Overall, I wouldn't recommend any major changes to your diet, as you seem to have great knowledge for your overall health and well-being in regards to your oral health as well. Keeping strong habits will greatly decrease your chances of caries and other dental diseases in the future. Thank you for joining me today. Do you have any other questions?
I don't think so.
Great. Thank you so much.
Thank you.